Hi, my name is Gianna, and I'm going to be giving a speech about the burdens of being a medical professional and abusing substances. Um, this is to inform listeners about the various ways of why and how medical professionals can fall short of um, substance abuse and how they could possibly recover. When you think of someone who abuses drugs or alcohol, what do you picture? Picture it for a moment. Now, imagine a nurse who is taking care of your loved one intoxicated off of painkillers because of her back issues. Or a surgeon who is about to go into a 12-hour surgery with the smell of alcohol on his breath. These are not the normal professionals or not the normal addicts that you think of who are abusing drugs, but addiction does not discriminate. Now let's talk about how this may happen. Workplace stressors and job dissatisfaction can contribute to medical professionals abusing substances. Nurses and doctors and surgeons work long hours, being in physical pain with the demands on their body might require prescription drugs. Career dissatisfaction because they're surrounded by death, illness, or having bad management. Regardless of the benefits and salary, they still can fall short of this. According to Psychology Today, physicians have become pressured by the need to increase their patient load, which then burdens the nurses with more tasks, usually performed by the doctors, resulting in higher stress levels to both. Now let's talk about how this may occur. Medical professionals have easier access to controlled substances. Stealing over the years has become increasingly more difficult, but medical professionals still figure out how to do it and or bluntly show up to work intoxicated. Um, do the Pyxis Med Station is a new way of obtaining drugs. It uses barcode scanners and user login usernames, so it knows which nurse or which doctor logged into the system to get drugs out. Um, but nurses can siphon out of vials, medical or medication bags, steal narcotic waste. So when pills are to be thrown out after the patient is discharged, they don't throw them out, or they document that they have given the medication to the patient and they pocket it and take it themselves. Doctors might illegally also write themselves prescriptions. um, Realization of a substance use disorder and the path to accessing help or penalties or possible penalties. Realizing a professional colleague may be abusing drugs, they're sluggish or tired, they might be jumpy, irritable, not demonstrating like their normal work ethic, their scrubs might be all like their work attire is not well kept. The individual themselves needs to come to terms that they have an issue and that this can affect other humans and that they could be putting their patients in harm and their career. Medical professionals are usually the caretakers and problem solvers, so seeking help may be difficult, and if they do seek help, it's hard for them to become the patient. Um, Substance abuse affects many different demographics, even if it's accidentally. The addiction still can occur and interfere with patients' health if medical professionals fall short of drugs and alcohol. Patients place enormous trust in their healthcare providers and workers and deserve to have confidence in this type of care when in a healthcare facility. With possible evidence of being high or under the influence at a healthcare facility, in a court of law, nurses or healthcare providers can be held accountable for these offenses with imprisonment, supervised release penalties, along with losing their career or their ability for their licensure to be taken away in some states. Now I have some visuals, which I'm going to move up for. This first one is just the 2012 National Survey of Drug Use. So this is across the board, not just healthcare workers. 23 million people stated that they needed help. 19.5 million did not receive help, and only 2.5 million actually sought help. So they stated that they needed it. These people did not get it. These people got it. Then workplace-related substance abuse stats. 2016 survey of Canada and the U.S. This one said 62% of workers were saying that stating that they were depressed. 50% stated that they had an alcohol use disorder. 32% had said that they had a prescription drug disorder. And then recreational substances was at 29%. Then this last one is substance abuse among healthcare professionals. 10 to 15% of healthcare workers that will abuse alcohol or drug at some point in their life. 55 doctors were surveyed. 69 said that they have tampered with prescription drugs. And that's concluding my speech. Thank you guys for listening. That's all I have.